I'm here with Dr. Brandi Luedtke, clinical psychologist and head of the PTSD clinical team at the Phoenix VA Medical Center. Dr. Luedtke, thank you so much for joining me today.
Thank you for having me.
As we're in the month of June and it's PTSD Awareness Month, we're trying to shine a light on PTSD and help raise awareness about treatment options. Maybe we could start by understanding the scope of the issue. How common is PTSD among our veterans?
So trauma exposure is fairly common. So 1 in 2 people will be exposed to a traumatic event, but doesn't necessarily mean that they're going to go on for a diagnosis of PTSD. It's slightly higher in the veteran population, military, due to exposure to things like war and combat. But generally in the population, it's about 7% of people have a diagnosis of PTSD. Like I said, it's slightly higher with the military population, ranging from anywhere from 13 to some of the Vietnam numbers are around 30%.
And how does PTSD manifest itself? What sorts of problems or ailments are associated with the disorder?
So first is that criteria A, which is an exposure to a traumatic event in which you felt yourself or someone else's life was threatened. Maybe you witnessed this. It can be anything from combat exposure to things like hurricanes, fires, car accidents, and so forth, sexual assault. And then after that, if you go on to have what we call different clusters of symptoms for at least a 6-month period, then you'll receive a diagnosis of PTSD. And so we look at it in kind of 4 clusters. So things like re-experiencing symptoms. So the person with PTSD re-experiences the trauma in some way. This could be things like nightmares, intrusive thoughts and memories that pop in their mind, flashbacks, which is a little less common, I think, than maybe what the media or movies portray. But sometimes people do feel as if they're going through the event once again and kind of lose touch with kind of the here and now and the present. So they have to have at least one symptom of re-experiencing, as well as hyperarousal. So things like being very keyed up, on edge, irritability, so hypervigilance, maybe checking their surroundings, not liking maybe people to sit behind them in a restaurant or to be standing behind them, kind of having your head on the swivel, as well as changes in mood and cognition. So a lot of times it's very uncomfortable to feel very hypervigilant, so they want to avoid those things. So that's another cluster, avoiding people, places, situations, and feelings that remind them of the traumatic event. And this leads to the kind of shutting down those emotions. Because they're so painful, we want to push them away. And so we notice that perhaps maybe folks that had more of a positive outlook on life prior to trauma might start to look at the world as maybe completely dangerous or no one can be trusted. Their mood may be more, kind of more depressed or kind of more pessimistic than before. So we look at those different clusters and ensure that it lasts over that 6-month or more period for a diagnosis of PTSD.
So it sounds like something that that is not necessarily easy to cure, so to speak, or solve. Is there a typical length of time that someone who's dealing with PTSD and enters into some sort of treatment can expect to find some relief?
Yeah, actually, we do what we call time-limited evidence-based therapies. And so the evidence-based just means that they've been highly researched to be the most effective to treat PTSD. And generally, the manualized treatments are about 12 to 15 weeks. Sometimes people might need a few sessions of kind of coping skills or kind of prepare them for trauma treatment, or a few booster sessions afterwards. But oftentimes, if they actually put their best foot forward, do the out-of-session practice, attend regularly, people do fairly well when we practice from a recovery model. So everyone exposed to a traumatic event has those clusters of symptoms that I described. However, there's a natural recovery for most folks where it comes down and they kind of resume their living again. For those that kind of get stuck, we look at those thoughts and emotions and what's avoided. And so a lot of our treatments help veterans with PTSD approach things that were typically avoided so that they learn that they are here and now, safe, and that they have that new learning. And oftentimes we'll bring family members, significant others into that treatment as well too.
Is PTSD the kind of thing that can sneak up on people, like weeks or months or even years after the traumatic event?
Yeah, actually, so it kind of depends on the situation and also that level of avoidance. So we see a lot of higher rates with Vietnam veterans once they started to retire, because part of that avoidance too could be, people working 70, 80 hours a week, substance use, other ways to try to avoid the trauma memories and kind of push it away. So they might be able to kind of cope with that for several years, but then when you take away those avoidance strategies, or over time, they just don't work as well. So we do see people that might come in many years after the trauma. But for the most part, it typically is around that 6-month frame, though, that people start to notice a shift, or maybe their loved ones have noticed that, might seem a little bit different.
Well, and mentioning loved ones is a perfect transition, because my next question is how can a family member or a friend of someone who is suffering from this but maybe doesn't want help or think they need help, how can someone in that situation help someone else who may be resistant?
Mm-hmm. Yeah, and that's a good question. We do get that a lot. I get a lot of phone calls from concerned loved ones, saying that I think my friend or my partner is experiencing PTSD. How can I help? And the biggest thing is really just to be supportive and to be there, let them know that you are there as a support system, because we know that that's a huge buffer for PTSD symptoms and recovery. I think another thing too is not necessarily to pry about details, but just allowing them to know that they're there if they want to talk. And we also have really great resources out there. The National Center for PTSD has lots of different resources. There's Be Connected To, where there's video testimonials of veterans that have been through PTSD treatment that I think that can be helpful. And they also have whiteboards that show the different treatments, so they have an idea of what to expect if they were to seek out additional treatment.
So what should be the first step for someone who's suffering from PTSD and they're ready for help, but they don't know what to do?
So I would definitely recommend to check out the National Center for PTSD website. Like I said, it has different treatment options, and there's also what we call a shared decision model. And so you can kind of walk yourself through about different options, what you might think might be a good fit for you, try to get a sense of what you think might be helpful. And we're always at the VA open. We have walk-in services in our general mental health clinic where people can get connected. You can talk to your primary care provider that can, contact myself as a program manager, and we can get people into, even if it's just to talk about treatment options or even just to assess for PTSD, I think can be helpful. So maybe if the person's not technically ready for trauma treatment, we do have other services though too that we can provide.
So really just initiating that conversation. It's not necessarily a commitment on anyone's behalf. It's just starting to explore what options are available.
Yep, completely voluntary. Yep.
Wonderful. Now, are there new treatments or therapies that have been shown to be effective in recent years? So perhaps maybe someone who tried to tackle their PTSD in years past and didn't have success, are there new treatment methods available?
Yeah, absolutely. So we're constantly researching and testing out, adaptations to the treatments that work well to see if there's other ways that we can adapt that as well. So the Phoenix VA was part of 14 different VAs in the largest PTSD study that just concluded this past year. So we're analyzing the data too to see, are there specific treatments or specific interventions in those treatments that match well, based on gender, ethnicity, types of treatment, kind of just teasing apart all the different avenues to see how do we keep improving these. We have 3 frontline treatments right now, which is cognitive processing therapy, prolonged exposure, and EMDR. I won't, but it's a long acronym. But a lot of community providers do EMDR and don't have as much experience with CPT and PE. So that's also an initiative that we have, is trying to get more people in the community trained up on like the 3 main treatments. Another newer treatment that I'm a trainer and consultant for is cognitive behavioral conjoint therapy. And that actually brings the partner into the treatment. That's a 15-week protocol, and we've seen wonderful results over the last 10 years. And we're starting to look at MDMA-assisted CBCT and possibly doing a study within the VA in the next several years, where it's already showing preliminary evidence in Canada back in the 50s. So we're always kind of adapting things, and yeah, a lot of research out there. So.
Well, it's good to know that there are sort of tried and true methods and potential new therapies, because I suspect that there isn't one solution fits all. It's different for different people.
Correct. And I do want to say too that not all the treatments involve talking in great detail about the trauma. Like I mentioned, the avoidance is a key kind of ingredient with PTSD. And so oftentimes that's what hinders people from seeking treatment, is that they don't want to talk about the worst event that's ever happened, which makes sense. But we do have other treatments where you might write about it, or you just kind of process what are the thoughts surrounding the event. Do you blame yourself? Do you blame someone else for what happened? And kind of looking at those different thoughts that keep people stuck with PTSD. So yeah, I don't want anybody to be scared off by thinking that I have to go into a ton of detail about a particular, event. So.
And how do you define success when treating PTSD?
So we have what we call measurement-based care. And so we have self-report measures where the veteran with PTSD will fill out what the symptoms of PTSD look like. So there's 20 items, and then we rate on the intensity. How distressing has it been over the past week? And so we use that in the therapy to process too, is that if it's not changing, maybe the treatment's not a good fit, maybe they're not following through with the out-of-session practice, maybe we're not working on the right trauma that's kind of, leading to the symptoms. And then, over time, we naturally see that come down in about that 12 to 15 weeks. We also have a clinician-administered PTSD scale, so same thing, going through the different criteria, assessing how distressing this is, and hopefully, by the end of that treatment, they feel good and we can, discharge them back to their life.
Wonderful. What would you say to someone who's watching this and struggling with PTSD, but maybe not sure they want help or need help?
Again, I would just look at the resources that they have online. Talk to other people. I mentioned be connected. Looking at testimonials of people that have been there. And oftentimes, veterans find out that, their battle buddies or their friends have also suffered from PTSD. So I think just having that open dialogue can be helpful. And they can always call the VA. Like I said, my number's online as well too, and they can call me directly if they have questions.
Well, that's wonderful, and we'll definitely share that information with our viewers as well. What else would you like people to know about the resources and programs for treating PTSD that are available through the clinic here at the Phoenix VA Medical Center?
I'd like to highlight too that we do a lot of telehealth. Even pre-pandemic, we were doing video appointments to try to outreach to some of the pockets further out in Arizona that might not be able to make it to the main hospital for treatment. So I always encourage people that, we try to accommodate as much as possible. That I've worked with veterans that childcare is an issue. So when the baby goes down for a nap, we do a session, and they can stay at their house. So telehealth is a really big option. Like I said, we have lots of different treatment options too. We work really hard to try to figure out what's a good fit and to meet the veteran where they're at, and just the recovery is possible. And so we're going to have our first inaugural PTSD summit. It'll be virtual this year. Hopefully it'll be in person next year. And we're partnering with the Prescott and the Tucson VA as well too. So it's June 29th from 9 to 12, and we'll be showing different presentations on things like moral injury. Traumatic brain injury is also very common with PTSD if they've been in some sort of blast or explosion. Intimacy and various topics. We'll be discussing the evidence-based therapies that we provide and that every VA across the country provides. And just doing kind of a Q&A and having other veterans share their stories. So we're really excited about that event.
And so this summit is something that's open to anybody who wants to attend.
Yep. And we hope that they will share it with their family and friends so that they have more awareness too of what PTSD might look like and how they might be able to help.
Well, that sounds great, and I agree. It's a start in a virtual sense, and hopefully next year it's something that could be held in person, and we'll certainly share information with our viewers about the summit as well.
Great, thank you.
Well, thank you so much for joining us. Is there anything else that we missed or anything else you'd like to cover?
No, I think that, just recovery is possible, so we want to try to reach as many veterans as we can. So.
Well, perfect. Thank you so much, Dr. Luedtke, for all that you and your clinical team are doing to help our veterans, and thank you for joining us today.
Thank you.